Assalamualaikum warahmatullahi wabarakatuh. My name is Ainul Izzati binti Abdul Halim and my group members Muhammad Alif Haikal, which is our group manager, Wan Nur Kristina and also Izzatun Nadirah will be presenting our group project entitled Frontliners, Our Heroes Against COVID-19. First, I will explain about our project overview. For our project, we had chosen to make a story about frontliners. We basically tells who is frontliners, what is their job, what had their sacrifice for us, and also what had they done to our country and also citizens during the pandemics. There are many frontliners in our country, in Malaysia itself, which is doctors, army, police, food panda, and even the citizen itself is the frontliners to themselves. Each of these frontliner has their own task, has their own job that they need to fulfill in order to serve to the country and also the citizen. For the job task, doctor has their own job or task, which is they had to accept and treat every patient and ensuring every patient will survive the COVID-19 virus or even the other virus during the pandemic. For the police, they have the task to control the citizen and to make sure the citizen follow the SOP during the COVID-19 so that the virus COVID-19 will not be spread widely. And they also has the task to control the crime during the pandemic so that the crime will at the lowest rate. For the army, they has the job to help the police to control the citizen according to the movement order control. There is also food panda. Food panda needs to delivery food. They are in charging in delivery food during our pandemic, and the citizen itself is a frontliner, which they had to stay at home and follow all the SOP that has been announced by the government in order to prevent the spread of virus COVID-19. Next, I will be presenting about our aim and also objective. For our aim, we want to make sure that everyone know who is the frontliner and what had they done for us and also the country during the pandemic of COVID-19. While our objective is to study about who is frontliner, what is the frontliner task, and how the frontliner has done their task or job during the pandemic of COVID-19. And we also have the objective to make sure that the citizen being more appreciative toward the frontliners, and also we have the objective to make the audience being more supportive towards the frontliners. Thank you. That's all for me.
Assalamualaikum warahmatullahi wabarakatuh. My name is Wan Nur Kristina binti Wan Muhammad and I'll be presenting on the moral values and the target audience for our project. So the first part is the moral values. There are two moral values that we can conclude from this project. The first one is to appreciate the frontliners' hard work. As a citizen, we must appreciate all the hardship and work that our frontliners are doing for us to ensure our safety and health. Do you know that all of their hard work that they have been through is very tiring and stressful? Other than that, they're also willing to take risks on getting infected just to make sure that we are safe and healthy. Hence, it is important to us to understand how amazing our frontliners in this country. That is why this story is to tell us that we must appreciate them more. The second moral value is to be aware and act wisely. As a citizen, we must always be aware and act fast if we have the COVID-19 symptoms by staying at home or just go to the hospital straight away. We should not ignore the symptoms and still wander around in public because we might spread the virus in the public if we are infected. Moreover, keep in mind to always wear masks and take care of our hygiene to avoid the virus spreading to others. Second part is to talk about our target audience. So our target audience for this project is mainly focused on teenagers and adults. We put them as our target audience based on their demographic and behaviors. The reason is we want them to be the good example for younger generations. So looking at two features, the first one is by demographic. Based on audience age, which are around 15 years old to 45 years old. We also look based on their audience stage of life. This involves college students, parents, high school students, and workers. The second one is by behaviors. The purpose of this is because we want them to understand how important our frontliners in our country. We also want them to be aware of the symptoms of COVID-19 and know how to act if they have those symptoms. Therefore, they can be a good example for younger generations, such as parents can show good example to their children.
Next is job task. We have 4 members in our mini project animation. First is Muhammad Alif Haikal bin Muhammad Atta as a project manager. He will convey information between the team and the client, ensuring people skill and organizational skill, understanding the strength and limitation of hardware and software, design and management of a project, responsible toward the overall implementation and day-to-day operation of the project. Next is Izzatul Nadirah binti Khairul Anwar as a multimedia designer. She will meeting with stakeholders to determine the project scope, conducting research on media technique and design ideas, designing and producing attractive multimedia content according to project, creating digital image, video animation and textual animation, creating original artwork for digital image processing. Next is Ainul Izzati binti Abdul Halim as a writer. She will creating character, action, point of view and interactivity, writing proposal and test screen, scripting, voiceover and actor narration. Next is Wan Nur Christina binti Wan Muhammad as a video specialist. She will capture studio quality photograph and video, produce and edit content and build a library of amazing product and service video, manage and oversee all technical aspects of video recording and editing, transfer the video footage to a computer, edit the footage to a final product using digital non-linear editing system (NLE). Next is our schedule on doing our mini project animation. We take 7 weeks to finish our mini project. On week 7, we discuss about group project idea. On week 8, we discuss about the storyboard. On week 9, we draw the graphic from storyboard. On week 10, we submit our proposal and prepare for final project. On week 11, we started with our video recording. On week 12, we combine the video, edit the sound and test the video. On week 13, we submit our final project and report.
Assalamualaikum and hi, my name is Muhammad Alif Haikal bin Muhammad Atta and I will present our storyboard for this mini project. So for the first scene, it's been called as exposition scene. This is because in these scenes, Afiq, which is one of our main character in this project, found himself have the symptom of COVID-19 after attending a ceremony at his friend's house. So for the second scene, it been called as plot point 2 scenes. This is because it is an extending from scenes 1. After Afiq found himself has COVID-19 symptom, he then rushed to the car and want to go to the nearby hospital. He then be escorted by the policeman and soldier. So scene 3 being called as rising action scene. This is because in these scenes, after he arrived at the hospital, he then met with Dr. Mahmud, which is one of the doctor that working in COVID-19 department. He then say to Afiq that Afiq need to be quarantined and need to do a swab test. So scene 4 being called as climax point 1. This is because in this scene, while Afiq quarantine after make those swab tests, in this scenes after a few days, the result of swab test is out, which is Mrs. Wawa, which is one of the nurse that working in COVID-19 department tell Afiq about the news, about the bad news. Afiq feel very sad about the news. So scene 5 being called as climax point 2. This is because after Afiq know that he is positive COVID-19, he then informed the hospital about his close contact. So then in this scenes, hospital reported to the government about Afiq close contact and need to do swab tests in order to prevent the COVID-19 to spread out. Next is scene 6, which being called as climax point 3. This is because in these scenes, after the government tell to others about Afiq close contact, hospital are packed with a lot of people that being a close contact of Afiq. This is because they are scared that they will spread the virus. This is tell about the struggle of a doctor in facing COVID-19 pandemic. So next, scene 7, which is being called as falling action. This is because after 2 weeks of quarantine, Afiq get good news from Mrs. Wawa that he are free from COVID-19. He then thank all of doctors and nurse that treat him there. So scene 8 has been called as resolution scene or ending scene. This is because Afiq have learned a lesson through his past that he also can get those COVID-19 even though he is apply the SOP that have been made by the government. So in this is all of the frontliners, which is doctor, nurse, police, soldier, food panda man, government, and also Afiq reminds other people to take care of themselves and not to take COVID-19 as a as a small disease. So that's all. Thank you from us.